Don't miss that!
So welcome to the Don't Miss That Radiology podcast. I'm Matt Hartman from Pittsburgh, PA. And episode 1, we're talking about the law of burps and farts, looking for free air. So we're going to talk about reading an abdominal radiograph. It's important to have a systematic approach. Stones, bones, mass, and gas is how I like to do it. So stones, anything radiopaque, always starting with lines and tubes. You got to explain everything radiopaque. Kidney stones, gallstones, that sort of thing. Bones, normal or abnormal. Mass, is there any mass effect on the bowel? And we'll save the best for last, bowel gas. We'll ask the questions, is there free air? The bowel gas pattern, is it normal or abnormal? And if it's abnormal, obstruction or ileus. So a lot of burps and farts. Remember, air rises, so it's very important to know how the film was taken. Was it taken supine or erect? Because obstruction and free air will look differently. So how do we know? Well, a lot of times it will be labeled, but if it's not labeled, look for clues. Look for air fluid levels, especially in the stomach. Okay, we're going to start with a normal supine radiograph, and we'll see air in the stomach, in the transverse colon, and in the sigmoid colon. So, upright or supine, look for air fluid levels. You'll only see those if it's upright. And we'll talk more about this when we do small bowel obstruction tomorrow. Okay, so let's start with this radiograph. Stones, bones, mass, and gas. I don't see any lines or tubes. Bones look okay. No mass or mass effect. And bowel gas, we got the colon on the outside, small bowel on the inside, a little bit of distal gas. This is normal. And free air, is there free air? Well, we have to know how to look for free air first. So let's learn. There's our ascending colon, stomach. Okay. How about this patient? Stones, bones, mass, and gas. Anything radiopaque? These are EKG leads, but what is this thing? This might be the most important radiograph we see today. July 1 new interns. This is a feeding tube in the right main stem bronchus. That needs to be repositioned. Everything else is okay.
Don't miss that!
Okay, how about this patient? Stones, bones, mass, and gas. They have an enteric tube. It's going in the stomach. That's good. Bones look okay. No mass or mass effect. How about bowel gas? Is there free air? Well, this is actually a chest radiograph for the upright portion of the acute abdomen series, and there's air under the right hemidiaphragm. This is free air. Air is rising. That's where we want to look if the patient is standing.
Don't miss that!
So causes of free air, you always worry about a ruptured viscus. Trauma patient. This was actually a post-surgical patient. This was a expected finding. What if the patient is too sick to stand? What is our next best view? Well, hopefully they can lie on their side, left side down, right side up. The air rises and we'll see air between the liver and the abdominal wall. This is free air. What if they're too sick to lie on their side, or we just get a supine radiograph? Well, let's look at this image. Lines and tubes first. Feeding tube going in the stomach, that's good. Bones okay, no mass or mass effect. Is there free air? Well, we have to know what free air looks like on a supine radiograph. Air is going to rise anteriorly, so we won't see it under the diaphragm. Instead, we will see something called Rigler sign, where you get a sharp wall. So you have air in the peritoneum, sharp wall, air in the bowel. That makes for Rigler sign. And you can go back, look at the other radiographs, but the small bowel is not this sharp. So if you're seeing a sharp wall, think free air. That's Rigler sign.
Don't miss that!
Okay, what about in babies? This is a newborn. So let's do lines and tubes. Enteric catheter going in the stomach, that's good. Bones, I don't see any fractures. No mass or mass effect. How about the air pattern? We're going to look for free air first. Do you think this baby can stand? No. They are on their back. So again, we're not necessarily looking under the diaphragm, but if we know the football sign, we see the sharp line That is a falciform ligament. They have air in the peritoneum, air, falciform ligament, air makes for a sharp line there. This has been called the football sign. Basically, you get the ribbing with the falciform ligaments. So that is free air in a nutshell. We talk about this in our new book, Don't Miss That, as well as in our associated Tech Talks. Here's the QR codes for that. So please subscribe to our channel and be looking for part 2 tomorrow, where we'll talk about small bowel obstruction, ileus.
Thanks for listening to the Don't Miss That Radiology podcast. I'm Dr. Matthew Hartman. Remember, you only see what you know. Keep learning and don't miss that.